أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسوله الكريم. So we're going to talk about the impact of psychological trauma on the brain. And in this presentation, we're going to focus primarily on, we'll first introduce the nervous system and the brain. We'll talk about the ways in which traumatic stress will affect the brain. We'll also go over some of the brain structures and the chemicals that are directly affected by a psychological trauma. And we'll review briefly the comparison, the differences that have been seen between brain scans of those who experienced trauma compared to those who did not. And then we'll talk about some additional considerations regarding these effects on the brain and how it can affect other areas of life as well. So the human nervous system is divided into the central nervous system and the peripheral nervous system. So the central nervous system is your brain and the spinal cord. And the peripheral nervous system is the set of neurons that extend from that system out to the rest of the body. You may or may not know, but neurons is the primary mode of communication within the nervous system. And the signal is passed via neurons through neurotransmitters. Part of the peripheral nervous system is the somatic nervous system. Now, this is the one that communicates with your sense organs and voluntary muscles. So, for instance, if you put your hand in a bag and you were poked by a needle, that poking of a needle, that sensation is going to be sent through an afferent or sensory input, a nerve from that fingertip to the central nervous system. And then the central nervous system will respond, and there's going to be a signal sent to the motor or efferent nerve or neuron, and it's going to ask the muscle to contract so that you pull your hand out of the bag. And again, this is a response that's in most cases automated, and it isn't something that we necessarily have to focus too much on, although there is a part of it that has to do with a conscious response rather than an automatic one. The autonomic nervous system, on the other hand, communicates with internal organs and the glands. And the two components, or the two phases that it could be in, are the sympathetic nervous system and the parasympathetic nervous system. The other ways to describe these two components is a sympathetic nervous system relates to a fight or flight response, sometimes also fight, flight, and freeze response. And a parasympathetic nervous system is a rest or digest response. So for human beings, a person may either be in a fight or flight response, or they're going to be in a rest or digest response. And we'll talk about that in a bit. Coming down to the brain is, as you may or may not know, has different areas that have different functioning. The three categories of the brain that it has been divided into are the hindbrain, the midbrain, and the forebrain. And it's important to remember that the hindbrain is primarily responsible for existence. So things like breathing, walking, all that is done by the hindbrain, specifically the cerebellum. Now, if you go to the midbrain, this is the most primitive brain. So if you look at human beings' existence, for example, everybody needs to breathe, everybody needs to walk. So that's part of the hindbrain. And beyond that, human beings and animals both have certain characteristics. For example, a emotional or fear response. And that's part of the midbrain. Now, what's unique for human beings is this forebrain, specifically this area outside that would be considered the cerebrum. And this cerebrum is more developed in human beings than it is in other primates and other animals. So if we go back to our midbrain, this is the area that we'll be focusing more on when we talk about psychological trauma. Now, coming back to the peripheral nervous system, when we talked about the autonomic nervous system, recall that the parasympathetic was the rest and digest component, and then the sympathetic was fight, flight, or freeze response. So how does this exactly happen? Now, um, imagine yourselves sitting, on a couch, and you're enjoying, some kind of a meal. At the time between the two, the parasympathetic nervous system will be most activated. So your pupils will be constricted. There's going to be salivation because you're eating, and because your body is digesting. Your heartbeat's going to be slow because that blood doesn't need to be pumped so quickly. Airways are going to be constricted because you don't have to breathe as much, and your body doesn't need as much oxygen. The blood flow is primarily going to be directed to your stomach and intestines, because these are the ones responsible for the digestive processes. On the other hand, let's assume that your sympathetic nervous system was activated. So imagine that you were walking down the street, and all of a sudden a bear popped out of nowhere. And you're confronted with this animal who your body now perceives as dangerous. And so when our body goes into the sympathetic nervous response, or fight or flight response, freeze response, there will be changes that occur within the body. And most of these changes are happening to accommodate for what the situation is. So for example, your pupils will begin to dilate. And the reason that happens is because at that moment when you are confronted with danger, you are going to be running, right? That's the flight response. And when you're doing that, you want to take in as much light, as much information as you can through the eyes, and you're not paying attention or focusing on the minor details. So, to give you an example, in some cases, you notice when people get into fights, when their sympathetic nervous system is activated and they're angry, they sometimes end up hitting people that they normally wouldn't hit, and it's only because they're not able to recognize those faces and make distinctions between who's an enemy and who's a foe, and who's a friend. And the other thing that happens is the inhibition of salivation, because your body again is not digesting, so the blood flow is not towards the digestive system. There's going to be inhibition of the stomach activity and anything else that's related to digestion. And the reason for that is all that blood is going to be pumped to your periphery, the muscles, mainly, and that's in case if you have to run or if you have to fight, you need to have more muscle strength. And in order to accomplish that blood flow increase, your heart is going to start beating faster and faster. So you can see that once a perception of a stimulus has been made by the brain, so it's the brain that takes in the information and perceives it as something that's dangerous or something that's safe. Right? Should the person be in fight or flight response? Should it be in rest and digest response? You may have teachers, for example, professors, that you may feel very comfortable with, and so when you're with them, you're very relaxed, you're not as anxious, and so your body is going to be in a parasympathetic, side of the autonomic nervous system. On the other hand, you may have another professor that you are afraid may call you out or may fail you, and you're worried about not doing so well within the class, and so in front of that professor, your sympathetic nervous system is going to be activated. So again, it's the brain's perception. It's your perception of the situation. In many cases, even the example that I used of a bear, for someone who's been around bears, like someone who is a bear trainer, um, when that person goes in front of a bear, their sympathetic nervous system will not be activated. But for someone like you and me who do not come across a bear very oftenly, um, whenever we see one, we're going to have this kind of response. And it's important to remember when we talk about trauma. So when a person experiences trauma, that stress, that anxiety, now remember, trauma is an anxiety based, PTSD or trauma is an anxiety based disorder. And so what that does is that will cause two types of changes within your body. One type are the acute changes or and chronic changes that are both in the brain chemicals and also in the brain regions. And then what that also leads to are the long-term changes in the neuronal connections and the brain structure. And both of these then end up causing the physical or the physiological symptoms of a psychological trauma. So some other areas of the brain that are important to remember, we talked about the big areas, but some of the specific ones where changes do happen in the neuronal activity and the connections. First is the frontal lobe, right? This is the part of the brain which is right in the front, in front and above your forehead. And this is where emotions and personality is primarily developed or stored into. And this is the area of the brain which develops, it doesn't finish developing until the 20s. So this is the last area of the brain that is actually developing as the person ages. And one of the examples and the way that this area of the brain, the frontal cortex, was discovered to be associated with emotions and personality is a famous case of Phineas Gage. Phineas Gage was a railroad worker, and while he was working, there was an accident, and a metal rod went through his frontal lobe. And the rod was removed and the damage was repaired. But what they found was that Phineas Gage was having his whole personality had changed. His emotional functioning was much different than how he was before the trauma. So within this frontal cortex or frontal lobe is the medial prefrontal cortex, and this is where the associations between emotions and context is made. So let's use an example of a person who goes to an area where he feels comfortable, relaxed, and serene. For example, a mosque. And so this area of the brain is responsible for making that association, that connection between the emotions that the person is experiencing and the context in which those emotions were created. The parietal lobe is responsible for senses and spatial coordination. And so a person's ability to take information in from the environment, recognize the visual spatial differences that exist. The temporal lobe is primarily responsible for auditory processing, which also includes processing of language, receptive language, and also processing of any kind of sounds that the person might hear. And the occipital lobe, which is all the way in the back, is responsible for visual processing. And so, as I said earlier, a person's perception of what the person's experiencing will then, lead to a person being in a sympathetic or a parasympathetic response. One of the areas that we want to talk about, which is part of the midbrain, is called the limbic system. Now, the limbic system is a system that deals primarily with emotions and also memory. Now, what's interesting to note here is that part of the limbic system, you have the amygdala, the hippocampus, thalamus, hypothalamus, and the olfactory bulb. But what's important to note is the proximity of amygdala and hippocampus. So you can see that these two areas of the brain are right next to each other. Now, amygdala, which deals with emotions and specifically threat response, and hippocampus is responsible for learning in long-term memories. So specifically, a short-term memory to consolidate into long-term memory goes through the hippocampus. So if these two areas of the brain are right next to each other, you can imagine how emotions and especially threat responses are linked with memories. So if I asked you to think about the last time you went on a vacation, and if you closed your eyes and thought about it, that you're trying to recall that memory, one of the things that you'll begin to experience are the emotions that are associated with that memory. Similarly, if you started experiencing fear, or let's say even embarrassment, when you experience a specific emotion, and if it's a strong emotion and you've experienced similar emotion before, you will begin to recall memories that are associated with that type of emotion. So the connection between memories and emotions is very, very strong within the brain. And as I said before, because this is a primitive area of our brain, and this is the part of the brain, the hindbrain and the midbrain that's even within animals. So a lot of the times that when human beings respond to some kind of a threat or a stimuli, in most cases it's automated, it's automatic, it's happening instinctively. It's not something that is done on consciously or purposefully. The thalamus is the relay station for all the senses. It's where the signals are transferred between the lobes. And so all of the senses, with the exception of smell, and for the smell we have the olfactory bulb, but all the senses go through the thalamus and then go to the different parts of the lobe where they're supposed to go. So for example, visual stimuli will come through the thalamus and then go to the occipital lobe. Auditory stimuli will come through the thalamus, through the ear to the thalamus, and then will go to the temporal lobe. And hypothalamus is what's responsible for the autonomic nervous system and also control of some of the hormonal production. So some of the chemicals that are released by the hypothalamus will go and ask another adrenal gland, another gland, to then produce another hormone that may have an effect on the body. And then the olfactory bulb, which is part of the sensation of smell, as I mentioned before. So when it comes to, as I said before, the chemicals, the neurochemicals that are used to communicate, within the nervous system are called neurotransmitters. And then the chemicals that are used to communicate, for example, our stress response are called hormones. And hormones and neurotransmitters do interact with one another, but they don't. For the most part, work independently. Norepinephrine is a very famous neurotransmitter, common neurotransmitter, also known as adrenaline, which is responsible for alertness and arousal, and it's primarily activated during the flight or fight response. So a person who's in a fight or flight or freeze response, the levels of norepinephrine within their body will be high. And those high levels of norepinephrine will then lead to all of the changes that we previously saw with dilation of pupils, inhibition of salivation, increased heartbeat, the blood pumping to the muscles, and the lack of the blood flow to the gastrointestinal tract. All of those will be seen as a result of a high level of adrenaline or norepinephrine in the body. And when it comes to a traumatic stress event, this is a short-term response. As compared to cortisol, which is a hormone, cortisol is primarily responsible for calming the body down after a fight or flight response. But if a person who has gone through a trauma, now that traumatic response isn't going to be completed or done within a few minutes. Remember, a traumatic response is different than an immediate response that a person might have that may invoke fear. So, you might see something really fearful, and after a few minutes, you're calm, and that's it. So the only thing that might have happened was that you had a little bit of spike in your norepinephrine, and then cortisol came in, and your body calmed down, and everything was okay, and the cortisol levels then went down to normal. But in a severe psychological traumatic response, so for instance, someone being raped, what you're going to get is this a high spike of norepinephrine during the trauma, followed by a high level of cortisol that remains there for a very long time. So this is involved in a long-term response to psychological trauma. Now, there are factors that affect how the trauma will impact the brain. So, for instance, age of when the trauma was experienced, the age of the person who experiences the trauma is also very important. And this is why it is important for us to keep into consideration when we work with different people from different age. So, for instance, children, when they experience trauma, are going to have a different response. Their brain's going to be affected differently as compared to adults. Not only are children going to have a different response, like immediate acute response, but it's also going to impact their brain especially when it's developing. So if you remember from earlier slides, most of the brain is developed with the exception of your frontal lobe, and which finishes developing in the 20s. And so anything that happens during this time is going to have a severe negative effect on the development of your frontal lobe and other areas of the brain, depending on when the trauma occurred. You also have to remember is that the children do respond differently. So, for example, two adults yelling at each other, an adult might see that and say to himself or herself that this is a normal response. People fight all the time, or it's common as long as it's not something that's someone's dying. They're just yelling, raising their voices. So an adult might be able to rationalize that response, and he or she may not be affected, and would not consider it as a traumatic response. On the other hand, if a child is experiencing or is witnessing two adults, let's say the parents yelling in front of the child, because the child cannot rationalize the response, because the child cannot understand the response, and moreover, a child's brain's not developed enough to be able to comprehend the bigger picture that's happening, that yelling of two individuals, mainly the parents, will have a severe effect on a developing child. The other factor that will affect how the brain is impacted by the trauma is the type of trauma, obviously. If the trauma is severe, let's say it was a physical trauma, a person was beaten, there's also going to be some physical effects on the brain that happened because of the trauma. So somebody got hit in their head, for instance. If somebody experienced, saw someone dying versus seeing them getting hurt, if someone was in an accident compared to the witness an accident, there's going to be different levels of exposure and experience. And again, it's the brain's perception. It's your perception. So not every trauma is same for every person. Some people get severely traumatized by even looking at images that are traumatizing, and some people are okay even after seeing someone in real life die in front of them. So when it comes to post-traumatic stress disorder, or PTSD, it's important to remember that not all traumatized people will have PTSD. PTSD has specific signs, specific criteria that has to be met before a person is diagnosed. In a nutshell, most people with PTSD will re-experience the trauma. They'll have flashbacks, nightmares associated with the trauma. They will be engaged in avoidance behavior, so they will avoid the type of situation that caused them the trauma, or the type of person or type of stressor or stimuli that caused the trauma. They will also have hypervigilance, or their body's always going to be in a fight or flight response. And then sometimes PTSD individuals also have symptoms of derealization, like out-of-body experiences, depersonalization, etc. So not everyone who experiences a trauma will be diagnosed with a PTSD. Everyone who experiences a trauma will have a certain effect on them, whether it's going to be a short-term, temporary effect or a long-lasting permanent effect. That depends on the person's age, the person's resilience, the type of trauma experience, etc. Now, when we talked about cortisol and norepinephrine levels, remember that norepinephrine is involved in alertness and arousal, and cortisol was the hormone that comes in to calm the body after the stress. So according to this research, it was seen that when a person is experiencing a stressor or a traumatic event, in their body they will have a higher than normal cortisol level and a higher than normal norepinephrine level. So both of these go up, and they stay up. And this is specific for child abuse survivors with PTSD. So we're talking about adults or those who have grown up now, but they had child abuse when they were young. So their cortisol level and norepinephrine level is actually higher than what would be normal. And normal for adult, for example, cortisol would be lower than normal, and for a child it might be a little bit higher than normal. But with someone with a stressor or trauma will have a higher level of both of these. And both of these will have a long-term effect on the person. Cortisol, for example, has been shown to have severe effect related to the cardiovascular diseases that a person may experience because of high level of cortisol. And so this specific study suggested that there is a long-term effect of childhood trauma on the neurochemical systems of the body. And when those systems are um, changed, and when there is a abnormal level in one or two of these, this can cause other areas or other problems in other functioning areas as well. One of the other changes that take place inside the brain is this reduction of the volume of the hippocampus. Now, if you remember from a few slides ago, we talked about the hippocampus, which is primarily responsible for building long-term memories and consolidating the short-term memories into the long-term memories. And so what the research has suggested is that adult survivors of child abuse who have PTSD will have a smaller hippocampus as a result of the trauma as compared to those who did not experience trauma. So you can see in these pictures here. Now, this can mean a lot of things. This can mean the person will have difficulty recalling long-term memories, they have difficulty storing long-term memories, consolidating their short-term memory into long-term memory, and building new long-term memories. And so that can severely affect a person's functioning. A person who is traumatized, say 20 years ago, a person went to war, and as a result of the war, they start experiencing symptoms, and they were diagnosed with PTSD. Now, 20 years later, they live a normal life with their family. They go out and enjoy things and go on vacations, but but they're not able to build those long-term memories or store their short-term memories into long-term memories as efficiently as they were before the trauma or as compared to other individuals. And so another thing that this can happen is this can also lead to the brain development. So a child that was abused, and experienced trauma and has PTSD, as the child grows, their hippocampus is going to be smaller than those individuals, those children who did not experience trauma. So again, all the things we talked about memory-related issues, will be present, with those who experience trauma. And other traumas like combat and adulthood traumas, there's mixed results or no changes in volume. But in any case, what you can conclude is there is an effect that's happening physically on the hippocampus, and that effect is not healthy. It's not normal, and it leads to a lot of lifestyle issues and difficulties within the person. Other things that can happen, there can be changes in the brain activity, so changes in the neuronal connections. So, to give you an example, let's say a person used to go to a park and would feel comfortable, would feel relaxed, or let's say they went to a mosque, they felt relaxed there, but let's say that they experienced some kind of trauma at the mosque. So if they were a child, maybe they were beaten by the teacher at the mosque. Maybe as an adult, someone tried to, if this is from, say, Middle Eastern or war-torn country, in a war-torn country, you'll have people that will try to blow up the mosque or have some kind of fighting or killing around the mosque. So if a person experienced that, that's going to change in their mind the perception of what a mosque is supposed to be. So now they go from a mosque being a place where you feel relaxed, spiritually elevated, comfortable, to a place that causes them anxiety, that triggers an anxiety, that leads them to believe that this is a dangerous place for me. Because every time they are closer to a mosque, or they see a mosque, or they hear about a mosque, or they're inside a mosque, their fight or flight response is activated, and they're always anxious around that area. And hippocampus, we talked about before, related to memory. But one of the things that always also happens is the activity in the hippocampus is decreased as well. So not only is the size decreased, but also the hippocampus is less activated with those that experience PTSD. There is an increased activity in the amygdala, and if you remember, the amygdala is responsible for threat response. So with increased activity, what you see is that the person is always experiencing a threat response. So the person is always in a fight or flight response, and that's where the hypervigilance comes from traumatic individuals. One of the things that you often see with those who had childhood trauma is that they're always moving around. They almost behave as if they have ADHD. They are always causing, behavioral and other issues within the environment. Um, and so one of the sayings that have been addressed in the literature is that the certainty of misery for these individuals is preferred over the misery of uncertainty, meaning because they're so used to the trauma, because they're so used to the chaos in the environment, that these individuals don't feel comfortable when there's uncertainty, when they're not sure that something may or may not happen. So they create that misery, they create that chaos within the environment to feel comfortable within that. So that increased activity in the amygdala, that threat response, leads to then behavioral issues within the environment, having problems with friends, family members, and other individuals as well. There's a decreased activity in the medial prefrontal cortex, and the medial prefrontal cortex, which is part of the frontal lobe, it's in the front of the head, is responsible for creating associations between emotions and context. So, as we said earlier, let's say that a person was beaten by their mother when they were young. So, typically, a context of a mother is someone who's loving, caring, and now this person was severely beaten or constantly beaten by their mother, so they were traumatized. So their medial prefrontal cortex is going to, not be able to create that, strengthen that positive imagery, or may create a negative connection between the person and their mother. And now the context is changed and their emotions change. So instead of feeling love, instead of feeling care, they feel fear or even hatred. And this also accompanies an increase in amygdala activity. So amygdala, which is responsible for overall emotions and threat response, mix that with creating a decreased activity in the medial prefrontal cortex, that's going to create a lot of negative associations with things that are not associated typically with trauma. And this was observed in PTSD survivors who experienced either childhood sexual abuse or even combat trauma. Some other potential influences on the brain related to trauma. We said before the psychological trauma may not always account for the changes in the brain. So it's not always the case that someone who experiences trauma is going to have some kind of a change within their brain physiology or anatomy. Um, as far as the genetics is concerned, typically, there's no changes in the volume that were seen in, say, hippocampus between twins with combat-related PTSD and twins with no PTSD. So there isn't a lot of brain changes that may happen with people. Say if the father was traumatized and their hippocampus was small, is that going to affect the son? There's not a lot of research to support that. However, keep in mind that if a person grows up in a household where their parents had PTSD and the parents experienced certain level of hyperarousal, hypersensitivity, hypervigilance, they were avoiding certain places, they had fear of certain places, that is definitely going to be a part of the environment that the child grows up in. So the child is likely to also carry on those behaviors. So it may not be genetically induced, but it will definitely be environmentally induced for the developing child. And physical trauma, as I said before, are also associated with the psychological trauma. So somebody who goes through a concussion, has a concussion, or asphyxiation, which is loss of oxygen, they're being suffocated. That experience of being suffocated also has a psychological trauma. So not only is the possibility of loss of oxygen that directly affects or causes damage in the brain, but you have a psychological trauma that happened because of suffocation that's also causing changes in the brain that we talked about previously. Also, with trauma, you have to remember there may be other comorbid psychological disorders. As I mentioned before, PTSD or trauma is an anxiety-based disorder. So you may have a person who has PTSD also begin to have social anxiety disorder, generalized anxiety disorder, maybe some other kinds of phobias that they didn't have before. And those comorbidities, again, can also cause brain changes and brain damages. Also, substance abuse. A lot of people who have trauma in the past, especially with those who are re-experiencing the trauma again and again, they have, flashbacks or nightmares. They may engage in using alcohol or other substances to calm themselves down, to calm their anxieties, and that leads to a disorder of alcohol abuse or other substance abusing other substances. And again, that in itself can also cause damage to the brain and changes to the brain activity. So it's important to remember when we conclude this that this connection between psychological trauma and the physical brain itself, that effects of the psychological trauma can be acute, chronic, and long lasting on the person's body. So, not just the brain, but when we talked about the peripheral nervous system, going back to the autonomic nervous system, which was, if you recall, the sympathetic and parasympathetic branches, sympathetic being the one that's responsible for fight, flight, or freeze. So a person goes through the trauma and their psychological trauma, it's going to have a lasting effect on the body. Their pupils might be dilated all the time because they're having a sympathetic response. Um, their GI tract may have problems. So they might have stomach problems. They might have, ulcers and other stomach-related issues because of the anxiety that they're experiencing from the trauma that they experienced. The psychological trauma can also impact the development of the person into adulthood. And so, not only the physical development, so, if we take everything into consideration, someone has a psychological trauma, their brain is affected, so the brain development is affected, their relationships are affected, so their social development is affected. They're also, say, drinking alcohol or using drugs, so we have even physical consequences of their psychological trauma that builds on into their adulthood and affects their personality negatively. Some of the changes that we talked about, changes in the neurochemicals, for example, norepinephrine and cortisol specifically, changes in the volumes within certain areas of the brain, for example, the hippocampus. We talked about changes in the activity in the amygdala um, and the medial prefrontal cortex, and also the neuronal connections and the brain activity. So, as I mentioned before, a person who before didn't associate certain aspects with a specific activity or a place will now begin to do that due to the neuronal connection that was built because of the trauma. And there are other factors that also can be involved. Now, one of the questions that people always ask is, can these be reversed? Now, as far as the physical changes are concerned, there is research on that suggests that the effects of trauma in the brain can be reversed. However, it will require a, a long period of time in which a person is rehabilitated. They're able to process their memories, their traumatic memories. They're able to go through therapy and say even medication if necessary to be able to do that and rebuild those neuronal connections that were affected. So For example, if a person was sexually raped, if a woman was sexually raped when she was a child, and now every time she sees a man, she feels afraid, she feels scared, she feels threatened. Um, that experience with the man, and if she avoids it, which is what people with PTSD will do, is going to further reinforce that behavior. So she'll avoid men, she won't see men, or she might go in front of a man and, because of her anxiety, do something that may cause the man to react, and then that reinforces her belief that I should be afraid of this man. But after a long exposure, a long period of time, after having positive interaction with another male figure, then she might be able to rebuild that neuronal connection, between her perception that a man is dangerous, to something that's more positive. So it is possible to reverse some of these effects, but as I said before, it takes a long time. And the other thing I want to mention before we conclude is that a person uh, who is more resilient is less likely to be affected by a trauma. Now, obviously, everybody has a threshold, so it doesn't mean that someone who's resilient is not going to experience any trauma at all. The effects of trauma will still be there, but their functioning may be less affected if they have high resiliency. So it's important that as we develop, that we are building resiliency as well. If we have children that we are catering for, that we're trying to build resiliency within the children so that when they grow up, they have enough resiliency to be able to experience some level of trauma without having too much anxiety towards it. So with that, we'll end, inshallah. If there's any questions, please feel free to contact me and I will answer those. وآخر دعوانا الحمد لله رب العالمين. والسلام عليكم ورحمة الله وبركاته.